Brooks going to stay, or did he have to go?
He's here somewhere.
Right, chat.
It is a little bit after 12. Oh, sorry. Let me start over again. Commissioner Purdy is supposed to team in, so as soon as she does, I will announce that. We are doing a call, so Dr. Tribble.
Present.
Commissioner Haynes.
Here.
Commissioner Levy.
Here.
Commissioner Brooks.
Here.
Commissioner Medici.
Here.
And I am here. Okay. I'd ask for, has everybody had a chance to go over the agenda, look at it, see if there's any changes, and it can be only informational and do an action item. Does anybody have any changes for the agenda?
Chairman, I'll make a motion to approve the agenda as presented.
Second.
It's been moved and seconded. We approve the agenda as amended, or as presented. Excuse me. All those in favor?
Aye.
Aye. Okay, at this time, it's in-person public comment. Okay, we have none. Open discussion. Hearing none, we will do the introduction of new employees.
Good afternoon, everyone. Beth Crete with Family and Clinic Services. I am happy to introduce two employees today. Becca Kaminsky.
Hi.
Hello.
She is working with our WIC division, Women, Infant, and Children's. And do you want to share a little bit about yourself?
Sure. Hi, I'm Rebecca Kaminsky. And I am so excited to be here today. I'm not gonna lie. So I have quite a bit of experience working in a lot of different kind of areas. I've worked security, I've worked food service and customer service and cash handling, and nothing has compared to being a mom and the challenges and the joys that come with that. And when I became a mom to my daughter in 2019, I had no support, and it was horrible for me. And there were a lot of mistakes made. But with my son, I had a tool in my toolbox that was just absolutely phenomenal, and that was the WIC program through the Central District Health. I got to be participating with them. It was approved about 2 months before my son was born. I went into labor in a breastfeeding class, and I utilized every service they could give me. And because of that, my son breastfed until he was 19 months. And I formed such a unique bond with him that I didn't even imagine was possible. So I have been brought on as of November 25th, 2024, as a breastfeeding peer consultant. And I am so excited to get to share that experience with other moms, whether they're brand new moms or maybe experienced moms like I thought I was, that just need a little bit more help. So that's me in a nutshell.
Thank you. Awesome.
Thank you.
And next, I'm excited to introduce Amy Mendoza.
Hi, I'm Amy. This is my first time doing family clinic. I come from OB, so I'm really excited to do family clinic and help the community and all the services that we have. It's been great working here, and I'm excited to learn all the new different things that you guys have available here.
And she's our newest medical assistant.
Okay.
In our
Awesome.
district, so.
Thanks for being here.
Thank you, guys. Thank you.
Okay.
Thank you.
We're to the board minutes. Has everybody had a chance to go through the minutes of the November 19th? Ask for a motion to approve.
I would make a motion we approve the minutes as presented.
I'll second.
Okay, it's been moved and seconded. We approve the November 19th, 2024 meeting minutes as presented. All those in favor?
Aye.
Any opposed? Motion carries. Now we're going to go on to the approval of the Health 2025 meeting calendar. Has everybody had a chance to look at that? Is there any, I know we can actually adjust that as we go, but tentatively, is everybody good with that?
Commissioner, I'm straight. This is actually a version 2.0. The board approved this last month and we caught a couple of errors, so it has been corrected.
Okay.
Yeah.
So we're it's not what it says, it just says approval of board, so
Yeah, it's a reapproval.
The reapproval as it's been fixed. Okay. I ask for reapproval of the Board of Health 2024 meeting calendar.
I move we reapprove the Board of Health meeting calendar.
Is the year's agenda in our packets?
Yeah, it's on the tab following the budget.
That should be it right there, Dr. Tribble.
Nope, right there.
Thank you.
I'll second.
Okay, then moved and seconded, we approve the Board of Health 2025 calendar, meeting calendar. Any further discussion? Hearing none, all those in favor?
Aye.
Troy, ready? Yes,
Good afternoon, sir. I stuck in right behind you.
Okay.
Good afternoon, everyone. Happy Tuesday. While you're turning to the expenditure section of your packet, I thought that since this was our first month of kind of reporting 1 month back, I just, as a kind of a rule of thumb, I'll add just kind of a what's happening that's closer segment, just so you kind of feel, so I can report back if there's anything that might have happened from this period that might have happened in November, just to keep you abreast of anything that might need your immediate attention from the prior month. And for November and to date, nothing has happened and everything is kind of moving along like normal.
You know, that sounded hollow.
I know it did. It kind of run a little bit. I'm not gonna lie. I'm like, wait, is there an air pocket in there?
Sorry.
No, it's true. It's true, 100%, yes. So at this point, we're still fighting, kind of our daily struggle with LUMA. I did make some headway with our financial statements, so we're still, the audit itself is done. We're just kind of trying to tie up the financial statements. Was waiting on some information from Health and Welfare, and they've been working really hard to get us that data. I received something this morning, so I think we'll be able to kind of move it along to get that data to the auditors so that they can start working on that piece. But other than that, everything else is kind of moving along like normal, and we haven't had any huge elephants storm the castle. So we've done well so far. All right, so from the expenditure report, you can see our target for October is 33.3%. You can see our revenues over expenditures are in the negative this month, and that is a little bit out of the ordinary, and primarily that's because we had to produce, so I don't want to go too far into the weeds about how LUMA works, but when we issue invoices, intercompany invoices, they go immediately into revenue and they show up on the report. Whenever we have to do credit memos, that kind of reduces that revenue for that month. And we had a handful of credit memos as Health and Welfare is kind of getting through kind of their processes. They're starting to kind of say, hey, we need this and we need this fixed. So we produce those credit memos. And you can see from the revenues, you can see a contract revenue For the environmental health, you can see that 240, 132 is a negative. What that is a huge credit memo that we had to produce for, we were working through the last billings of the COVID immunization grants to finalize that, which finalized several months ago, but we're still kind of working with Health and Welfare to get that payment done. So we issued a credit memo to them, which created that negative amount. So it should level itself back off when we look into November as we reissue that invoice. But that's why that's a little upside down for this month. You can see for county contributions, we're right on target. Our fees are a little bit above normal, or at least above the percent to actual, and that is because we issued a really large percent of our food fees have gone out the door. That should settle back down as time goes on and the revenues stabilize. Contract revenue is just about where it's supposed to be. Interest is going to be higher just because I didn't guess it would be that high, so it will just be high. And then other revenue should start trickling in as we cross into the new calendar year with some of those other grants coming in. So that should also level itself out. For personnel, we're just a bit under in personnel, which is good. I was a little concerned, but I think we're kind of leveling out. We do have quite a few, not quite a few, we have a handful of vacancies. So that's kind of contributing to that. Operating is above where it should be. And the primary reason, you can look down in T&B, you can see T&B for this. This is kind of the central function of the district. You can see we're just barely making a dent in T&B, and that's because some of the work that were done in those sub-grants, particularly around like the Community Health Block Grant, those were initially intended, or we thought they would be a sub-grant, and they wound up to be contracts just based on the nature of the work. So those will wind up in operating. I've been in conversations with Nikki and the division administrators about where does this really live, and we may come in the next month or so to request a movement from T&B up into operating as we kind of decide what those contracts or those agreements really look like, and in the long run, will we be using that T&B where it's at, or does it need to be moved up into operating? But we'll know more, I think, after we cross the December reports, which will happen in mid-January. That is the main part of the district. Any questions so far that I may help with? All right, moving on to the next page, you can see is the adult crisis activity. So this is, you can see we're just about right on target for our revenues over expenditures. That 125 is the money that we receive from Magellan every month. And we are way above where we anticipated we'd be in contract revenue, just because the amount that we anticipated that we would receive would have been through Health and Welfare, which was quite a bit less. What we're getting from Magellan is 125, which is quite a bit more than we initially anticipated. But you can see based on the expenditures that we're spending it all. So it should be a relative wash. And then for personnel is a little bit higher than it should be. I did reach out to the program manager, and she was talking specifically about how this will start leveling out as she starts leaning on some of her other sub-grants. So that should start getting in line as we get closer to the November-December reports. And then operating and T&B are the ones that I kind of mentioned in our last report, where this is one of those relationship questions. Is it a contract? Is it a sub-grant? When we initially created the budget, our thoughts would it be sub-grants. And I just met with the program manager in November and talked with her specifically about what that agreement looks like. And based on the federal code, that cannot be a sub-grant because it's a firm fixed fee, and it's over the actual agreement with the provider is over the threshold. So it has to be a contract. So we will probably at one point need to request to move those monies from T&B into operating for the adult crisis center. And then for the youth crisis center, there is a little bit of so again, we received 125 from Magellan from them. This month we had 158,000 against our 125. This just is because there's other funds other than what we get in contract revenue. There's also some of the IDJC funds that we've been sitting on that are kind of supplementing that difference. So you see personnel is a little bit low, and operating is a little bit high. So again, kind of the same scenario, the same provider that works for the adult also does the youth, and so that kind of same T&B operating contract environment lives. And we may need to kind of talk about, so initially when we had put the budget together, the program hadn't really anticipated that the work that was going to be done on the facilities for the Youth Crisis Center would be capital outlay, so there wasn't a budget line for that, so we may need to request to move that as well. But we'll know more. Well, that one I do know. That one is going to have to be requested to move, but we don't have that on the agenda today. But I figured as we go along and make these decisions, I just make that move in one swoop. And so it'd be easier just to do that. So at this point, we're drawing down, I think, the IEJC funds pretty well. And we should get through those. And you can see kind of that drawdown just from the beginning of the fiscal year and to the end of the end of October, based on our cash balances. The beginning of the fiscal year to October, we're down by 200,000. So a chunk of that is really based on our drawdown of existing cash for those activities. Any questions I may assist with?
On the audit, how accurate are we going to be on getting the information to our auditors?
So, Mr. Chair, that's a great question. I am anticipating, and I'm doing everything I can to work. I've got a meeting with Health and Welfare today to talk over some of the information they're providing. They're doing the best they can to get data out, but it definitely is not ticking all the boxes. There is likelihood of finding, and I'm just doing everything I can to prevent it. Most of the finding will be not specific to what we've done, but the data that pulls out of Luma and how it's presented in the finance.
We're the ones who get the help for that.
It is, yeah. So unfortunately, there's not a lot I can do with it. I've been working with, the gentleman's name is Jeffrey Pard. He's their financial, kind of my counterpart in public health. And he's put together a pretty robust document, but even he said, it's like, I can give you a 70% chance that the data is all there. And so I'm working with him today to kind of finalize what that looks like. The struggle that I'm having, and this is particularly around the CEPA, the financial statements, we're struggling still with the controller's office to get. I can't get them to respond, so I may need to reach out with a little bit more clout, but is getting cash balance. There's a segment of our financial statements that says, here's what Luma says our cash is, here's the reconciliation that we did with the data that came out. Those two are not matching. And I have banged my head against the wall until all my hair fell out. That's why it fell out. Just kidding. But I think that's probably going to be an issue with the auditors, and I think the CEPA is going to be an issue with the auditors. I don't know that it's going to be a finding that it will stay with us for a few years until we get it resolved, but I don't know that for sure. Once I'm able to kind of finalize those, I'm meeting with our contractor this afternoon, and once we get those financial statements sent over, then I will probably stay in pretty close connection with our auditor and just kind of try to do the best I can to kind of minimize the damage. I don't see zero damage. I mean, I don't. I mean, there is some potential if we get it right that just that saying it's close enough for government work isn't really a thing. So,
Okay. Well, thank you. I just knew that was going to be a problem. Thank you. Appreciate it.
Thank you, Mr. Chair.
Is there any other questions for Troy? Okay. Hearing none, we'll move on to the 2025 Board of Health Work Plan. Nikki.
Thank you, Mr. Chairman. In your board packet is a draft of the Board of Health Work Plan. This is informational, although I'll take feedback if you have any. I have met met with each of you individually and been taking your input as we develop this. So this is kind of just an outline for how, what we'll be discussing with the board through the next calendar year. Of course, we can always add in things if something, pertinent comes up on our end or if there's a special request from the board. Our focus this year with regards to kind of our special presentations is to focus on our services and programs to support young children and families. And as I've mentioned in my conversations with you, that kind of aligns us with where the State Department of Health and Welfare was really wanting to reduce the number of children entering foster care. And Beth and I will be meeting with the director on Friday to talk about some of the ideas that we have on things that we're already doing, but where we can either have better data sharing or referral programs, or not programs, but referral connections, just things that can maybe kind of amplify our work and make it more impactful. Also trying to get some data from them so that we can see, if anything that we're doing on our end is going to move the needle, which might be hard to measure because there's a lot of things going on, but it's still helpful to kind of just see, where we're at. And talking with you all, I think I got pretty much everything that, all the feedback or input that I received with the exception of two areas that come to mind. One is one of our board members had a conversation with me about air quality and concerns about air quality and monitoring of the air, and if there's anything from like a local government entity or the health district where we could work in collaboration to share better communication when air quality is bad, and maybe potentially even monitor it. So it's not like a space that we work in, and right now DEQ does a lot of that work, and we just kind of like, the air's bad, we can help with some messaging there, but we don't really have, scientists on our team that have that expertise. So that's just an area that we're talking about internally a little bit, but it also came up in our internal think tank team that was doing some future kind of predicting, talking about like what threats there might be to the public as we move into the next few decades, and respiratory health was an issue that came up, and air quality was a part of that conversation as well. So I think that we'll continue to have some conversations about that, but we don't have that specifically built into the agenda for next year. The other conversation that I had some questions around had to do with questions regarding clinic operations and utilization, which I think is very something that we definitely want to have the board engaged in. I don't have it built into this agenda or this work plan, in part because we're working with a third party to do an assessment of all of our satellite offices and services that will be internal and external to help inform those types of conversations. So I kind of want to have that happen first so that we're not maybe having one discussion that then is later informed and kind of leads us maybe down a different path later. So sorry, it is written down, and we will, I commit to getting us there, but it will take a little bit of time. There are a few work sessions in here that we planned again. That was something we did new last year, so we'll have a budget workshop in February. We'll have a little bit more dedicated time to just that on the agenda. May we have our budget hearing. The other work session, we'll have some incident command system training, kind of building off what we did this last year. And then again, we'll have Public Health Symposium. I'm hoping to have that in November instead of December. This year worked well to have it in December because we had a group of new legislators that would not have known what their committee assignments were if we'd held it in November. So it was the timing, I think, worked well this year, but next year I'd like to try and do that in November. So those are kind of some highlights from the work plan. If there's any additional feedback that you'd like me to have, I'm happy to take that. Otherwise, this is what you can expect for next year. And it's just information.
Okay. Any questions? Thoughts? Okay. Bringing on, move on to an action item, which is policy and position statements. approval.
Buckingham was gonna be here, my sidekick. I don't know where he's at. Okay. Oh, that's right. But I thought that was later. Okay. Well, I'll do my best. So this is again, the position statements and funding priorities that I kind of use to work off as the legislative session comes up. It also, I think, will be helpful. Commissioner Purdy, who's our executive council president actually this year. You've seen this now for a couple of meetings. I haven't made any changes with it, with the exception is with page 7. I tried to clarify some language around the pools, because I think that was the last one that there was a little bit of concern about us having in here. And just to kind of refresh you on the topic, currently the Department of Health and Welfare oversees the pool authorities, I guess statute rules. And there's some conversation around the director having interest in relinquishing some of those authorities and giving them to the public health districts. I don't know how that looks yet. We're actually meeting this after, the public health directors are meeting with his legislative staff person this afternoon to talk a little bit about this and some other things. He has interest in the public health districts taking over, I guess, for lack of a better word. If that were to happen, particularly because we knew pools has been mentioned already, this is one that we would probably want to see a little bit more change in. Currently, I'm in follow-up to our conversation at the last board meeting, I think I said that we only inspect the municipal pools in our district. That's actually not completely accurate. I've got better information. We inspect them, but we also inspect some pools like the YMCA and some of the hot springs, but not all the hot springs. So it just kind of depends.
Hot springs?
Mm-hmm.
Public hot springs.
Yeah, public hot spring, like the
Zims? I think Zims
is one. There's one in Mersing.
Gibbons.
Gibbons, thank you, yes.
Mr. Chairman.
Yes, sir.
This raises a concern of mine that the state is going to pass off an unfunded mandate, but at the same time, the state has, for all intents and purposes, stopped funding us. So if we're going to take this on, and I hope you relay this to the director, at least this is my opinion, I guess I can tell him myself, but if we're going to take this on, then legislatively, we need to have the authority to set the fees that cover the cost of doing said inspections. This does not need to be, I guess it would be an unfunded mandate to the taxpayers of our 6 counties, and to that I will object.
I would say also in public health district directors are in agreement with what you just said.
Okay, good.
And we have communicated that, and we'll communicate it again this afternoon when we meet with them.
Thank you.
Yeah, the one thing that I think for us is, assuming that the fees were able to be set, is that we would like to have a little bit more reach into like some of the way public pools are defined in Idaho, as I think you guys probably heard Jeff mention earlier today, is anything that's over 2 feet of water. So like splash pads are not regulated, and then most pools are not either. So today we don't need to figure that out, but I just want you to know that like from the district's perspective, we feel like for public health, we're really going to do something meaningful that is intended to decrease waterborne illnesses, chemical exposures for over treating water or drownings, which I learned that we're also second in the country for drownings, unintentional drownings.
That's probably not a swimming pool.
Probably not.
Canal.
Probably mostly recreational
miles
water.
of free water.
But you think it'd be like Minnesota or like a coastal state. Idaho. So I was still surprised.
Well, much of that water is swift.
Yeah. So,
Swift and cold.
yeah,
But it's fun.
true.
It's really fun.
Yeah.
It is. I mean, I agree,
It's
absolutely.
a risk.
You're on the end of a ski road.
Yeah.
But
Going down the canal.
with Brooks, I agree that, I mean, I'm being pretty blunt about it. If we can't set the fees, I don't think we even go down that.
Right.
I totally agree with you on that. I don't think we can't be just spending taxpayers' dollars on stuff and not have the ability to, because it's not all the taxpayers that should be paying for, polls and stuff.
Yeah, I mean, people generally pay for that. So, I mean, to
admission, right?
use it unless it's like a public splash pad or something that's in a park, but they still paid for the park.
And Commissioner,
Yeah, go ahead.
from my opinion too, I think I would like to see that if we're gonna reach out and doing something that is currently not being done or regulate something like that, I would like to see that, the benefit of doing that outweighs the cost.
Absolutely.
And that the public is something that would benefit the public and that they want. At this point, I haven't really seen that evidence come forward.
Yeah,
So,
we haven't seen anything. We just know that there are issues with public.
Sure.
We just have to, there has to be something that pushes us to go in that direction beyond just, we want to do it. I mean, there has to be some actual statistics on what we need and why it's there. Again, if we're not going to be able to charge for it, I think we just drop it.
Well, I think, correct me if I'm wrong here, but if Director Adams decides, sounds like he wants to go this direction, right? Does he need legislative approval or some change statutorily that takes this from his wheelhouse and puts it to ours? And if that's the case, then he should be on board with our other fee legislation. That's the only way I can see it being foisted upon us, is if the legislature does it rather than Director Adams.
Right, I think his intent is just to strike those sections of statute and rule out. They just don't exist at the state level. So I will learn more about that this afternoon, and I'm hoping that if the intent is to do that there's some opportunity for the districts to work together on probably all 7 districts, I would think, because we'd want to do something consistent if we were going to do something at all to replace that.
Commissioner Brooks, are you going to that also?
What?
The meeting?
This is the directors.
Okay.
This is our regular directors meeting.
Okay.
But it might be something for executive council to talk about, and I think they're going to try and meet in person in January during the IEC conference.
Yeah.
So we'll know definitely by then if they're going to do something this session. I might know this afternoon too, but yeah. So what we have written in here right now just says we support policy changes, but that expand the inspection of swimming facilities. But I'm totally open to other language here based on what I'm hearing, I think, and I agree, although it's not explicitly said in here, that the fee should cover the cost. I think to what Dr. Tribble said, if all these other things happened, I think we would need to have buy-in from industry and from the lobbyists that support like hotels and things like that, and get input from them, the gyms and things of that nature.
If we're not only incurring our costs, but you're incurring cost on the businesses or communities that are upkeeping these.
Yeah, and where we draw the lines, right? I mean, we look at what some other states are doing around us. Some inspect pretty much anything other than somebody's personal backyard swimming pool. Others don't do subdivisions, or they don't do like private gyms, or there's variances, and I think that's where it would be helpful to have like all 7 districts to try to come to some kind of agreement on doing something that looks the same.
Private property and private gyms they have to have insurance, and they have to follow insurance, and the insurance is dropped, and they have to pay for anything that comes out of pocket. So I guarantee you they do a pretty good job of taking care of private. I don't want to be.
Yeah, I think the liability of
Private insurance. We shouldn't do anything near private property.
Is there a definition of public pool in statute now?
Yeah, I think that's what It's very narrow, and I don't know, do you know?
If that's
anything
part of what, if they're gonna look at the
might
changes to
just be
this,
the
that they need to
definition.
just define what a public pool is,
Yeah,
and that way we know.
Yeah.
Right, just put a definition to it, this is a public pool.
and when that statute was written, I know for a fact, there weren't like splash pads, and these are like water features and things that kids play in, so that,
Well, any changes in that would have to come from the legislature, is that correct?
unless they struck that from the code and it fell on the public health districts to do something, but
If they struck
still-
it from the code, would it be totally open as to who has the authority or
I don't.
without actually putting it in code that the health districts have responsibility for that? That's what I meant.
Yeah, I think it would have to say something like that, otherwise it would be like every city and county figure it out for yourself.
Yeah.
That's something I'm not.
So it would have to be something that would actually put that responsibility on them.
So let's be very careful about the can of worms we need.
Yeah, absolutely. Yeah.
Because it could be a big can of worms that we might end up not wanting.
Well, anyone who's been commissioner very long has been down the road of when the state just hands something to you and what then happens with that, and it's not fun. It doesn't go well. Especially when they don't want to add new funding to it.
Well, we handed them off something that they're struggling with now too, so.
Yeah. We got them back for one.
Is this the courts or is it defender?
We did really well on that one.
Is there anything else that you
Well, that's the only one that I think you guys had questions about last month, so I didn't change anything else, and I don't recall there being any concerns about any of the other ones, so if my preference would be to have something in this topic area in here. If you would like it to be worded differently, I'm open to that.
There's too many questions, so. But
I think
Yeah.
when you guys get together and discuss it with the health and welfare director, come up with something after that, after we kind of get some ideas of what they're trying to do. And if they're gonna lay it on the districts, and if they are, if we're gonna be able to feed and all these other things that we're going to do as well.
Well, that was the other thing, like even just if we even just kept it as we are today, it wouldn't really, doesn't really benefit the public's health because it's so small and there's just,
You told me that it doesn't really do anything.
right, yeah.
So if we don't, if it doesn't work out, if what they're gonna let us do or give us the ability to do doesn't work out, then I suggest that we just drop the whole save money, because you're having to go out there and do it.
And we could only do that if it was removed out of statute,
Yeah,
which right now, we
that's up
still
to
have to
them.
do it for $50. It costs a little bit more.
Yeah, I bet it does, yeah.
Okay, so I guess for feedback from the board, thoughts on this wording, leave it in, take it
I
out?
think there'll be changes in the future. Okay, once you have your meeting, probably by next month, the board would have a better idea of what they need to do.
And if you get anything from the directors, what the other directors, what they're looking at, then we can make changes.
So does that mean take it? No, leave it in. I'm gonna help you out here, guys.
I think it's fine the way it is.
Yeah, I think
Everybody here knows it's that part's a work in progress, right?
Yeah.
So,
All right, we'll leave as is and
Placeholder.
know that there may be more conversations down the road.
you want a motion on that?
Yeah.
Okay, I make a motion to approve the policy and position statements as presented.
Second.
It's been moved and seconded, we approve the policy and position statements as presented. Any discussion? Hearing none, all those in favor?
Aye.
Okay, we are at the end, and we actually got it at 15 minutes.
Chairman Aberster,
Great job, all.
I noticed I made another date error. Our next meeting is not the 28th, it is the 21st, due to the Idaho Association of Counties Winter Conference. So I did update it on the calendar that you just reapproved. I failed to catch that one. Okay. So please don't come see me on the 20th of January.
You'll have missed the meeting.
Yes, it will be the 21st, and I will communicate. Also,
complaints. Last board meeting. I think it's because I just looked at you, but, so we have a plaque to thank him and a card that hasn't got around to be signed yet, but we're working on that. So, I know for the staff and myself, thank you for your years of service to the board. It's been great to have you, and you've been a good representative for Washington County.
I'm glad we had meetings here now, so I'm excited. That was a hope and a dream, so it's nice to be in this room after all those years of being next door.
Maybe pump yourself up to come to a board meeting.
Every once in a while. Now it's a lot easier to get to come, but back in the day, yeah, it was a little exciting.
Enjoy your family.
Chasing kids around? Yeah. That's the plan.
Enjoy your
Spent all weekend over here, gymnastics and basketball and stuff.
Well, if you ever bored. Or not bored, you just want to hang out.
Right? I might need your office every once in a while, take a nap and.
Well, thank you everybody for time, for coming into the symposium.
Yeah, it was fun. It was good. I really enjoyed the history wall. I took some pictures of it. That was fun. Yeah, it was good.
Also wanted to say to the staff, know that they did a great job on it. Yeah, the commissioners, they liked it. They were first hesitant to go through another station thing. Oh, but when they got into it, they loved it. It was great. They had another meeting at part 2. That's what I also learned.
Yeah, I think it's.
So you really enjoyed it, so staff, kudo on that one, did a great job. I like the topic, it's really good.
Yeah, thanks for the feedback. Yeah.
I concur. I think it was wonderful. Thank you so much.
Yeah.
Southwest District Health did a great job.
Yeah, we'll have to see, like, every year I'm like, are we gonna do this again? I think I'm really trying to get the legislators, and I'm glad we had a few show up today that are new, that are gonna be on health and welfare. Some I've met with individually, and they weren't here today, but at least I've had the opportunity to meet with them, so. Yeah.
Gives them an opportunity to come and get educated on what the agency does.
Yeah, yeah.
Yeah. It's hard, it's kind of hard to meet the Brown wedding one. That was a good time. We did that one. This one was fun. This was fun.
Yeah.
It's fun, it's stuff that's actually happened. Yeah, that's why I think it's good to learn from that. Like the splash pad thing. I mean, I didn't know that they didn't have to coordinate, you know, didn't recycle water. We don't have any in Washington County.
You just pull it out of the ditch and come back.
Right?
They've done that too, and hooked it up to the water fountain.
Yep.
Oh.
Also could be another topic for a future symposium.
Maybe we should do some of the, remember we had that case in your county, when it was just, they were dumping their black water in the river?
Yeah.
That'd be a good one to go through, maybe.
That one too.
You had that too, Jennifer?
Yeah. That was before my time.
Payette County?
It was before your time.
The pictures of that one were wild.
I actually put on our property, when I was a kid growing up on our property, the neighbors, the neighbors' pipeline that came from their house dumped on our property, and it was just raw sewage. It wasn't coming out of a tank or anything like that. It was just raw sewage. It'd come out and then went down and draw down into the bottom, and then down into a drain ditch, which then went into the canal, and which then ended up in the river. So that was normal back in those days. You know, the house was built in the 40s.
For the kids didn't play in the river again, I guess, right?
And we had two ponds at the bottom.
Oh, yeah, if you survived, you'd be good.
Yep.
It's a different time, different ways of doing things. Thank you all, appreciate it.
Merry Christmas.
Merry Christmas to you guys, and Happy New Year. See you in the new year.
Are you going to Memphis?
Maybe. Yeah.
But they had to have gone through some real crazy process to get there, right?
It's complex in some way.
Wow.
It's on your calendar.
It's on the calendar, I know that one.
Sure, one thing, but like,
Yeah.
our chickens, I don't think like cows are different. You know, I didn't wash my hands.
Do I look like
Yeah.
it?